Kerala on Thursday reported 7,738 new COVID infections and 708 related deaths, which raised the caseload to 49,37,135 and the death count in Kerala to 30,685. Of the 708 deaths, 56 were reported in the last few days. 542 were those which were not confirmed until June 18th last year due to lack of adequate documentation, and 110 were designated as COVID deaths after receiving appeals based on the new guidelines of the Centre and Supreme Court directions. Well, let's go across to Sneha for more on this. And Sneha, this is something we've been seeing over the last couple of days, these backlog of deaths getting counted in Kerala. Clearly, a lot of appeals are there. There are a lot of deaths which family members are appealing to be counted as COVID deaths.
Well, that's right, Gargi. If you look at even the last 48 hours, there are around 1,181 deaths which are actually backlog COVID deaths according to the state government, which have been added either based on the revision of petitions which have been given by the families in line with the revised guidelines, or after the change in the system that is being followed by Kerala, where doctors themselves can now certify, the treating doctors themselves can certify the patient as someone who has died due to COVID. So with all of this, if you look at just 48 hours, 1,181 cases of COVID-19 have been added, which are not fresh cases, but that which have happened over the course of the pandemic. And this is according to the state government. Now, this has also been a huge dispute between the ruling left as well as the opposition in the state. The opposition has been attacking the left government, saying that they have been trying to hide the COVID datas, the COVID death numbers, or to bring it or to portray it in a way that would be less. But something that the state government has time and again refuted, saying that they are going according to what the guidelines are. Now, the health minister of Kerala has also told in the assembly, when about certain deaths being unaccounted for, the health minister earlier this month told in the assembly that around 7,000 cases are likely to be added according to the revised guidelines. So that is something that is expected in days to come. These rising numbers are only expected to rise. They may not be fresh cases, but the backlogs which are now being added.